Hey guys, it's Dr. Hub. Today we'll look at the human diseases. So the human diseases of the DNA damage repair. So first we look at the defective non-homologous end joining repair. The defective non-homologous. So it's defective non-homologous end joining repair. So this is known as the NHEJ. And what are the diseases? The diseases is SCID, that is a severe immunodeficiency disease, that is known as SCID, as well as there is a radiation sensitive SCID, that is a severe combined immunodeficiency disease. Then the other DNA damage repair type will be the defective homologous. There is going to be a defective homologous repair. So defective homologous repair in short is known as the HR, and the diseases which are concerned with this are the ATD, ATLD. ATLD stands for the AT-like disorder, and then there is also the Nijmegen breakage syndrome. There is Nijmegen breakage syndrome. So in short it is known as the NBS, Nijmegen breakage syndrome. Next, what are we having? Next, there is Bloom syndrome. BS stands for the Bloom syndrome, as well as there is the Werner syndrome. Then there is also presence of the Rothmund. There is Rothmund-Thompson syndrome. So Rothmund-Thompson syndrome is nothing but the RTS. Next comes the breast cancer. There is the breast cancer susceptibility 1 and 2. So this is nothing but the BRCA1 as well as the BRCA2. Then there is a defective DNA nucleotide excision repair. The defective DNA nucleotide excision repair. So this is nothing but the NER. That is nothing but the NER. So what are the diseases associated with the NER, defective DNA nucleotide excision repair? So it includes the xerothelioma pigmentosa. We are writing it as XP. Then also the cocaine syndrome. The cocaine syndrome we are writing it as CS, and also the trithyodystrophy. There is a thyodystrophy. Thyodystrophy is nothing but the TTD. Next we look at the defective DNA base. There is a defective DNA base. So defective DNA base excision repair. So the defective DNA base excision repair. So what is the disease involved? Disease involved is nothing but the MUTYH associated polyposis. That is nothing but the MAP. Then there is a defective, there will be a defective DNA mismatch repair. There is a defective DNA mismatch repair. So the defective DNA mismatch repair includes the hereditary non-polyposis. So this is hereditary non-polyposis colorectal cancer. So in short we are writing it as HNPCC.